So today, we're going to dive into a group of diseases where your body's own circulatory system, the very thing that keeps you alive, well, it turns against you. It's a really fascinating and complex world, so let's get right into it. Just think about that for a second. What if that massive, intricate network that delivers blood and oxygen to every single part of you suddenly became inflamed, blocked, and just broken? That's basically what happens in vasculitis. It's a powerful and honestly a pretty terrifying idea. So, what's the official definition? Well, vasculitis isn't just one disease, it's a whole family of them. But the core problem is always the same: inflammation of the blood vessel walls. When those walls get inflamed, they can swell up and get super narrow, or even close off completely. And as you can imagine, no blood flow means no oxygen, and that leads to some serious organ damage. So the key takeaway here is that where this inflammation happens changes everything. Okay, so here's our game plan for making sense of it all. We're going to start with the body's biggest pipelines, the highways. Then we'll move to the main streets, the medium-sized vessels. After that, we'll navigate the really tricky side streets of small vessel disease. And we'll finish up with some classic medical mimics and a few cool tricks to help you remember everything. First up, the big guys. You see, the easiest way to classify vasculitis is by the size of the blood vessel it likes to attack. So we're going to start at the top, with the aorta and its major branches. These are the absolute superhighways of your circulatory system. So let's meet our first one, Takayasu arteritis. The textbook case here is a young woman, usually under 50. The inflammation goes right for the aorta, which causes some really specific signs. Because it messes with the arteries going to the arms, patients might get arm pain when they try to use them, and their pulses can get weak or even disappear entirely. That's why it has the nickname pulseless disease. A huge clue for doctors is finding a big difference in blood pressure between the two arms. All right, so we're leaving the highways behind. Let's head down to the next level, the main streets, or the medium-sized arteries that feed our major organs. Next up, we've got polyarteritis nodosa, or PAN for short. It's known for causing these little balloon-like bulges called aneurysms in the vessel walls. But here are the two things you absolutely have to remember about PAN. First, it almost never affects the lungs. That is a massive clue. And second, it's got a really strong link to hepatitis B. So if you see a case of PAN, you should immediately be thinking about testing for Hep B. Sticking with these medium vessels, let's talk about a disease that's a huge deal in pediatrics. This is a condition where getting the diagnosis right and getting it fast is absolutely critical to protect a child's heart. And that disease is Kawasaki. Its main target is the coronary arteries, the ones that supply the heart itself. To diagnose it, doctors look for a high fever that lasts for more than 5 days, plus at least 4 of the other signs you see here. And this is a perfect example of why mnemonics are so incredibly useful in medicine. Just remember the word febrile. F for fever, E for eyes that are red, B for buccal changes like that famous strawberry tongue, R for rash, I for internal lymph node swelling in the neck, and L for limb changes like skin peeling off the hands and feet. All right, we've done the highways and the main streets. Now we're turning onto the side streets. We're getting down into the tiniest vessels, the capillaries and arterioles. And as you can probably guess, the puzzle gets a whole lot more complex down here. You know, in the world of small vessel vasculitis, there's a famous trio known as the ANCA-associated vasculitis. They have a lot in common, but telling them apart is absolutely key. And by the way, ANCA just refers to a specific type of antibody that doctors can find in the blood, and it really helps them nail down the diagnosis. Think of this table as your ultimate cheat sheet for telling these three apart. So let's break it down. On the left, we've got GPA. It loves to attack the respiratory tract, both upper and lower, and the kidneys. And it forms these little clumps of inflammatory cells called granulomas. In the middle is MPA. It also hits the lungs and kidneys, but here's the crucial difference: no granulomas. And then on the right, you have eGPA, which is the real odd one out. If you see a patient with a history of asthma or allergies, you have got to be thinking about eGPA. It's a hallmark of the disease. It also forms granulomas, but they're packed with a special type of cell called an eosinophil. And just to give you a really memorable visual for GPA beyond what's happening in the lungs and kidneys, it can sometimes cause this really striking sign: red, bumpy, swollen gums that look, you guessed it, just like a strawberry. It's pretty rare, but if you ever see it, you'll never forget it. Now for another small vessel disease, and this one is actually the most common vasculitis we see in kids. It's called IgA vasculitis, though you might have heard it called HSP.
It's caused by these antibody clumps getting stuck in the tiny vessels. The presentation is so classic, it's known as a tetrad. That means 4 key symptoms that almost always show up together: a specific kind of rash on the legs and buttocks, joint pain, bad belly pain, and some kidney problems.
Okay, so we've seen what vasculitis looks like, but here's the thing. One of the biggest challenges in medicine is that totally different diseases can look almost identical on the surface. So now we're going to play detective and look at a few classic cases of mistaken identity.
Remember that strawberry tongue from Kawasaki disease? Well, it has a famous twin, scarlet fever. But as you can see here, the details matter a lot. Kawasaki is a serious inflammatory vasculitis. Scarlet fever, it's a bacterial infection from strep. The rashes are different. One feels like sandpaper. And here's the real so what. The treatments couldn't be more different. One needs powerful drugs to save the heart, the other just needs penicillin. Getting this right is absolutely vital.
Let's do another case of mistaken identity. When you see a painful, swollen joint, you might think of something like IgA vasculitis. But what if the inflammation isn't coming from the blood vessels at all? What if the real culprit is microscopic crystals setting up shop where they just don't belong?
And that brings us to the classic crystal showdown: gout versus pseudogout. It all comes down to what you see when you look at the joint fluid under a special microscope with polarized light. Gout is caused by these needle-shaped urate crystals that glow yellow. Pseudogout, on the other hand, is caused by rhomboid or kind of coffin-shaped crystals that glow blue. Different crystal, different shape, different color. That's how you tell them apart.
All right, to help all of this really stick in your brain, let's wrap up with some of the most memorable visual clues we've talked about. Think of this as your high-yield toolkit for spotting these conditions and telling them apart from their mimics. We've said the word strawberry a whole bunch, and it turns out it's a super popular description in medicine. We've already covered the strawberry gingiva in GPA and the strawberry tongue in both Kawasaki and scarlet fever. But just for fun, you can also see it used for a gallbladder that's full of cholesterol and for a specific type of cervical infection. It's a great example of how medicine uses these simple visual patterns to classify diseases. So there you have it. From inflamed superhighways to rogue crystals in your joints, it's pretty clear the human body can be a complex battlefield. We've seen that vasculitis is serious, sure, but it's only one piece of the puzzle. Understanding its mimics and why telling them apart is so incredibly important is really half the battle. So I'm curious, which of these lookalikes was the most surprising to you? Thanks for joining me for this explainer.